I'm Dr. Eric Smith, and I'm working with the Alzheimer Society of Calgary. I'm here today to answer some of the most common questions that people have about dementia. This video is made possible by the support of the Roman Catholic Diocese.
What is the best way to approach your family doctor with concerns of dementia? What if the family doctor isn't able to help?
The best approach is to discuss your concerns directly with a doctor. Bring your spouse, a relative, or a friend who knows you well to provide more information and support. The doctor will probably do a test of your memory or refer you to a specialist who can perform such a test. If you're not sure that the doctor is taking your concerns seriously, or you're unhappy with the advice you've been given, please ask for a referral to a specialist. Specialists that provide care for persons with dementia include neurologists, geriatricians, and geriatric psychiatrists. However, please also be aware that not all memory concerns are due to brain diseases, such as Alzheimer's disease or strokes. In some cases, your doctor may be able to reassure you that Alzheimer's disease or other brain diseases are not present, and may be able to find other factors that are affecting your memory, or be able to reassure you that the changes in memory that you've noticed are due to the natural aging process.
What should someone expect when seeking a diagnosis of Alzheimer's disease or other dementia?
Generally speaking, the doctor will ask you questions about the memory symptoms, when you notice them, whether they're getting worse, what kinds of symptoms you've experienced. Usually a test of memory will be done. The most commonly used tests are the Montreal Cognitive Assessment Tool, or MoCA, or the Mini Mental Status Exam, or MMSE. These tests may take 10 to 15 minutes to complete. If the memory symptoms are concerning, the doctor may then do additional tests that could include blood tests. If the symptoms are relatively new, like within the last few years, then a brain scan, such as a CAT scan or MRI scan, may be ordered. If the cause of the memory symptoms is still unclear after these tests have been ordered, more special tests may be needed, such as a type of scan called a PET scan that looks for patterns of metabolism of the brain that may be associated with diseases like Alzheimer's disease. If the diagnosis is still unclear, you may also be referred to a specialist, such as a neurologist, geriatrician, or geriatric psychiatrist.
After a diagnosis, what steps would you advise someone to take?
A diagnosis of dementia or mild cognitive impairment is an important diagnosis. There are a few steps that you should take. Among them includes making sure that you're in regular contact with your family doctor. You should be seen at least every 6 months if you have a diagnosis of dementia. There are some steps you should take that everybody should take regardless of the presence or absence of illness, but are more important when you've been diagnosed with an illness. These include designating an enduring power of attorney to help you manage your financial and other affairs. It includes a personal directive so that people can understand what your wishes are for your medical care and other wishes in case you're unable to express them yourself. And it includes having a will. These are good steps for everybody, regardless of whether they have an illness or not, but are more important in people who have had a diagnosis of an illness. There are supports in the community and resources for you. Please consider calling the Alzheimer Society. You don't need a diagnosis to call the Alzheimer Society. It's also important to understand that the Alzheimer Society provides education and support for people with Alzheimer's disease, but also with non-Alzheimer's causes of dementia and with mild cognitive impairment. Finally, there is an Alberta Health Services program called Home Care that can provide support for people living in their home. The services are designed to keep people living safely in their home, and they can do things like evaluate the safety. They can provide part-time support for a home health aide. And they're also the conduit for referral for day programs for persons with dementia. And either you or your doctor can contact Home Care for an evaluation.